At least one lawmaker on Capitol Hill says he has contracted COVID for a second time. Louisiana Congressman Clay Higgins wrote on Facebook that he, his wife, and son are all dealing with the symptoms, but that it's been far more challenging than the first time he says he got COVID back in January of 2020. Well, joining us now, someone who has been on the front lines of the COVID pandemic, Dr. Nina Radcliff. Dr. Radcliff, thanks for joining us this morning.
Thank you for joining.
First, we are seeing an increase in reinfections. Are we seeing an increase in reinfections as the Delta variant becomes the dominant strain? What's your assessment of where we are right now in the fight against COVID?
Here in the U.S., reinfection remains low. It's rare. Immunity after a previous infection does, in many cases, protect people from reinfection. But when it does occur, the illness tends to be milder. Immunity varies significantly from person to person. So while many people mount a strong, durable immune response that protects them against Delta after a previous infection, some may generate a weak immune response and remain at risk. Due to the unknowns, experts are advising people who have had COVID-19 to get fully vaccinated. So where are we now? The Delta variant is not last year's virus, and it's become incredibly apparent to healthcare workers and those and that we are dealing with a very different beast. Coronavirus cases are rising in every state as a result of the hyper-transmissible contagious Delta variant. Jan, it is an alarming spike with estimates of over 95% of new infections coming from people who have not been vaccinated. The data shows that there is a widening gap between unvaccinated and vaccinated. Those who are unvaccinated are most at risk. And Jan, I'm an acute care physician and anesthesiologist. The struggle to breathe, the stints on ventilators, strokes in young adults, the long-term effects that can afflict and sometimes kill COVID-19 sufferers is largely preventable. And despite the widespread misinformation, available COVID-19 vaccines are among the safest and most effective vaccines ever created.
And Dr. Radcliff, you just mentioned the majority of people who have been hospitalized with COVID have not been vaccinated. Also back in March, we learned that more than 78% of hospitalizations were among those who were obese. Is that still the case with these new infections?
Well, yes, the unvaccinated are most vulnerable. And while hospitalizations and infections increase, the good news is that we are not seeing spikes in hospitalizations in patients who are fully vaccinated in the hospital. And yes, we do know that earlier this year, the National Institute found that nearly 2/3 of COVID-19 hospitalizations in the U.S. could be attributed to obesity, diabetes, hypertension, and heart failure, findings which give insight into how underlying conditions contribute to hospitalizations during the pandemic. However, at this time, it is clear the unvaccinated are most vulnerable, including those under the age of 12. And while we are always concerned about underlying public health conditions, particularly in light of the earlier findings, time will tell how earlier findings impact these current hospitalizations.
And when it comes to vaccinations, doctor, we're still seeing some people who claim they were vaccinated, but then still contracted COVID. So what's causing some of these breakthrough cases, do you think?
Well, first, breakthrough infections don't mean the vaccines aren't effective. The effectiveness against severe disease and death is still substantial. The main reason we're seeing breakthrough cases is due to the number of people who haven't been vaccinated. Once more people are fully vaccinated, it'll help reduce the spread of COVID-19 because the virus won't be able to infect as many people. Until then, the virus will continue to mutate and spread, creating new variants. A very small percentage of fully vaccinated people can get COVID-19 if exposed to the virus, but they're much less likely to become sick or hospitalized. And someone can become infected with COVID-19 just before or right after they get the vaccination. It takes about 2 weeks before the vaccine is most effective.
And if you are somebody who's fully vaccinated, what type of symptoms are these types of people exhibiting?
Well, first, the CDC does not list different symptoms for the Delta variant or others. For someone who's fully vaccinated, it's very rare to experience severe symptoms from COVID-19. Vaccinated people typically see symptoms like a runny nose, which could be mistaken as a common cold, and the vaccinated are much less likely to be hospitalized or die. For the unvaccinated, the most common is fever, dry cough, tiredness. And less common symptoms are aches and pains, sore throat, diarrhea, headache, loss of taste or smell, rashes on the skin. And it's important to seek immediate medical attention if you have serious symptoms such as difficulty breathing, chest pain or heart palpitations, or even a loss of speech or movement.
All right, Dr. Radcliff, always great to talk to you. Happy Monday. Thanks for joining us. Have a great week.
Happy Monday, Jan.